Hello, everyone. My name is Jackie Hilton. I'm a social worker and psychotherapist, and I work with adults in an inpatient acute psychiatric hospital. And I want to introduce myself and my channel, Unsung Empath, as a way to provide resources for aspiring social workers or those wanting to enter into a psychiatric realm of social work. When you look on YouTube, you will find so many information about macro level social work, hospice, social justice, which is all great avenues to go as a social worker. But I wanted just to provide just kind of this path and what it looks like to be somebody who works as a social worker in a psychiatric hospital. So in many places across the country, psychotherapists could be a psychologist, it could be an LCPC, which is usually those with a master's in counseling, LMHC, you name it. There's acronyms for a lot of avenues. Psychotherapist is kind of like this umbrella field that has so many different licensures and pathways to becoming a psychotherapist. Social work being one of them. So that's what I got. I have a master's in social work. I wanted to do therapy, so I was kind of, full disclosure, I didn't go into social work because of a lot of the social justice stuff. While it's important, for me, my passion was to provide therapy for people. And social work was kind of the fastest way, but also I just love the concept of seeing the person not just for what's going on with them, but their environment, because I truly believe we do interact with our environment, and our environment kind of contributes to a lot of our symptoms. So I did like the philosophy and the theory of, the person in their environment. So kind of the day in the life of a psychiatric therapist is I go to my job in an inpatient setting, and I grab a lovely census sheet, which tells me all the patients on my unit. And I typically have about 6 to 9, depending on if I'm covering somebody else, then it's a little bit more, but 9 would be really the most, especially when you factor in some of the private rooms we do. And so I work side by side with what we call a psychiatric med provider. So those could be psychiatrists or psychiatric nurse practitioners, PMHNPs. And the two of us, we also have a third person, which is the discharge planner. I call them discharge coordinators or care coordinators. And we just kind of work as an interdisciplinary team setting with nurses, and just kind of work together to help stabilize patients with acute needs, whether it's symptoms, positive or negative symptoms of schizophrenia, mania, with those with a diagnosis in bipolar disorder, major depressive disorders, or borderline personality, you name it. There's a lot of stuff you see in an inpatient setting. That's kind of what I want to share. I get very kind of nerdy and passionate about therapy, what I do, and I just wanted to kind of have an audience to kind of discuss that, and in hopes of building interest as well as getting more people in the field. I really have a passion for what we do. I really believe we're making a difference. And I hope to inspire many of you to go and find your niche in in social work, but as well as maybe as a psychotherapist. So when I work with patients, the patient and the interdisciplinary team, we work to kind of assess what is the need of this patient, why are they at this hospital, and what's the goal of the patient, what are they hopeful for. So the med manager will work on the medication piece, and I will provide the psychotherapy. When we graduate from schools, I feel that we all kind of leave starry-eyed, but then we're in the field and we're like, oh my gosh, what do I even do? School doesn't prepare you for treatment of individuals with schizophrenia. I mean, we kind of talk about psychopathology. You have to take a course in order to typically get licensed as a clinical social worker. So you kind of have a vague idea, but there's no step-by-step how to do this. So what I feel is important for any social worker, but especially those in the psychiatric setting, is to find your niche and then build upon that with trainings. So I trained under Dr. Janina Fisher through her Part 1 and Part 2 complex PTSD training, which talked about structural dissociation, as well as taking a structural dissociation training under Kathleen Martin. And in the summer, I'll be working with Mark Nickerson for EMDR. And it's that kind of what I'm talking about. You have to find your niche and then build upon that. And it means you might have to spend a few hundreds or thousands of dollars to grow that niche, because, Therapist Aid, while it's a good resource, especially starting out, doesn't really give you the skill set to really address some of the symptoms people are dealing with. And for me, I work with a lot of individuals with trauma. And I would say that trauma is a driving force and factor to why so many people are hospitalized, in my experience, but also research. So trauma, I would say, is my niche, and that's what I apply in a psychiatric care. I also have taken cognitive therapy with the Beck Institute, so CTR. And so I have training in helping individuals with acute symptoms like those with schizophrenia, using psychotherapy, kind of help them access their adaptive mode, is what we call it, and just kind of stabilize in that way. I mean, really, I can just go on and on and on. There is so much you can do as a psychotherapist using psychotherapy techniques to really stabilize people without medications. And I'm not saying that medications don't have a role. It's just you have a role too. And we need you as therapists, as workers in the field. I want to just kind of say again, it's an amazing experience, especially if you want to kind of see a lot of the DSM-5 like symptoms and diagnoses kind of come to life. I would say psychiatric clinicians, social workers, something you would want to do. It's a great experience, and I just making sure I hit my point of what I do in the day in the life of a psychotherapist. So I meet with the patient, with the provider. I have one-on-one therapy in my office, which is awesomely decorated in the Friends TV show theme. So I have kind of where the patient sits, I'll be there for you, and I have a bunch of little pop figurines everywhere. You just got to make an individual feel comfortable and safe, I think. So I'm going to get in trouble by saying the word safe. You want to provide them a calming environment. Safe is a very, in my opinion, a triggering word, especially working with individuals with trauma who may have never felt safe. So calm is something we all can kind of relate to. At one point or another, we felt kind of calm. So having a calming environment is important. And I also run groups sometimes. Providing group therapy is a great way to have patients hear from other patients and kind of brainstorm in that way. Sometimes, you can hear somebody who, is a professional in the field speak, but to hear somebody is kind of in your similar life stage or similar experience, to hear them share what worked for them is a lot more, I feel, impactful versus somebody like me who may not have experienced the trauma or symptoms that they are experiencing. It's kind of like, what do you know? You're not in here. You're not in an inpatient setting. And they're right, I'm not. So it's great to have like group therapy where other people who are kind of side by side on their journey speak a little bit about what's working for them. It really kind of inspires each other in that way. Part of my channel also, I just wanted to I'm willing to answer any questions, and I'll probably touch a little bit about what's out there already, but I don't want to regurgitate so many of the resources that's already out there. I think like Mind Your Society is an awesome YouTube channel with so many resources and information for individuals wanting to go into macro level social work, find your niche in different type of fields of social work, as well as, the difference between psychologist or social worker. I think she covers a great job at the difference of that, as well as the rich social worker. I think she does an amazing job as well, exploring with individuals how to have a better income. I'm still trying to discover that too. So I'm not the best resource for that, but she's an outstanding resource. I want to direct you to those two channels for the additional resources. I kind of want to hone mine in more in like psychotherapy, as well as a psychiatric clinician type of role, as well as I kind of post funny like TikTok videos of me kind of pseudoly doing psychotherapy for my pets or friends or whatever. It's all in good fun, so I figured you guys might like that. My YouTube channel, my TikTok channel, as well as Instagram all have the same name, which is Unsung Empath, which kind of stems from the fact that social workers are very much the unsung heroes, as well as very empathetic in nature. So it's kind of a play on that. But I hope you kind of enjoyed what you've heard so far. If you have any questions, suggestions, or even inquiring a little bit about what it takes to become a psychiatric clinician or a psychotherapist, please write in the chat underneath, as well as subscribe to my channel, and I'll be more than happy to provide more information. I hope you have a great new year so far. Take care.